what the SafeGait offered that other even dynamic balance and gait systems didn't provide was, one, we really liked the fact that the dynamic fall protection and the body weight support was continuous, even if a patient had a loss of balance or needed to be, that the system maintained the body weight support. We liked the fact that, as we felt it and we tried out other systems, that the SafeGait system seemed to have less drag. So when a patient starts walking, they feel very little pull from the trolley up above. It's very responsive, and it seemed to be more responsive to us than other systems.
So from a technology standpoint, one of the things that is a requirement for me is to make sure that a therapist can get a patient set up as quickly as possible and get them going into their treatment. We don't want to waste time with elaborate, extensive setup. So one of the things that I like about SafeGait is you can get a brand new patient up and going in just less than a couple of minutes, actually. You do have to put the harness on the person, and that goes more smoothly over time as you know what size to select with them and what the best position is to get it on. But really, it is a pretty quick setup, and so that was kind of a must for us.
The other thing that we really liked was we were consulted when the system was being developed. And with that, we found that Gorbel Medical was very receptive to the input of the end users. So as therapists, we felt like we could make recommendations and give our opinions, and Gorbel Medical was really responsive to looking at those opinions and at times instituting that into the system. So with that, we really felt comfortable that as we owned it, that we were going to have a really responsive partnership, that if we had problems, we knew that they would be taken care of. And we've found that over the 2 years to be just the case.
Therapists are using it for all types of treatments. Depending on the type of patient, they may need assistance to go from a sitting position to a standing position. So you're using more body weight support in that situation. If it's a person who already can do that, then you're using it more for just balance. So you might reduce the body weight support down really low, but having the patient do really complex tasks that would be more difficult for the therapist to accomplish by themselves with the patient. So instead of having to focus on guarding the person so that they don't fall, you can focus more on the task.
As the therapist, a big part of it was the type of fall protections that SafeGait offers. That was a big piece of it. And also the customer service of the company. Gorbel's customer service was bar none the best of the companies that we were speaking with.
You know, I always wanted it to be a device that I thought could help the therapists. The big push in the industry is outcomes, getting people better, faster, having them in the right setting at the right time. And so return on investment, as you suggested before, you may not need to have two therapists or working with the patient at one time. That creates efficiency within your department. We've had instances where we've been able to negotiate higher rates with private insurance companies because of our technology. I think they understand that having this technology means that their patients will get home sooner, saves them money, and then we'll have a lower rate of hospital readmission. And that's really a big factor in the industry right now. If you can prevent a hospital readmission, that saves the system quite a bit of money. It's obviously it's a billable service, as it's always been, but we find that if you were able to do maybe 15 or 30 minutes of gait training with somebody using this technology, your sessions can be longer because the person isn't as fatigued.
The responsiveness, when we were communicating, the whole attitude that was coming, it was more of from Gorbel, it was this is what we have, this is where we came from and how we got to where we are. And it was more of we just want to show you what we have so that you can make an informed decision and you're very proud of your product. And there was no pressure involved in it, whereas from the other companies it was more putting down of the competitors and more pressure from them.
Gorbel Medical provided an ROI tool to us to use to look at the equipment and whether it made sense for Thompson Health. We used that tool, but also through our own finance department did our own validation on the ROI tool. And we were able to bring that validation forward to our finance committee and then to our board to get approval for this equipment.